It's PCOS Awareness Month, and now is the time to spread the word about the condition and its challenges for women. Joining us now, Dr. Lozzi, and of course, we want to get straight to it.
Yeah.
What exactly is PCOS?
Ooh, Polycystic Ovarian Syndrome. It's a long name. People usually call it PCOS. It's a combination of a hormonal condition that can affect women of reproductive age specifically, and it has a lot of things that go on with it. We'll talk about that later. But you know what's interesting? It actually affects about 10% of women. Unfortunately, most women with it, they don't even get diagnosed properly, right? They have it, they're underdiagnosed, they're misdiagnosed, or they get a diagnosis that's not what they should have to get it treated right. And about 50% of women will actually have diabetes by the time they're 40 if they have it and it's not treated properly.
Okay, so why is PCOS underdiagnosed?
A couple of things, right? We talk about cancer all the time. We talk about hypertension. We talk about diabetes. That's one of the things. There's not a lot of funding to it, right? And sometimes you sort of think, well, why isn't it? If it affects so many women, people just haven't talked about it enough. I think a lot of times because of things like missed periods, excessive weight gain, diabetes, people just don't think about it in terms of a diagnosis. And there's so many things that it can cause that it gets chalked down to something else.
Yeah, I can definitely see that. Well, what are some of the signs that we should watch out for? Because I mean, girls, women miss periods all the time.
Absolutely. So I think that's one thing, right? A regular period by the time you're 16, 17, 18 is normal, and that's how it should be. If you're missing 3, 4, 5 periods a year, that's probably something you need to check out. A lot of people have an initial sign of just acne, right? They have a lot of cystic acne, acne that they can't get under control. People that are a little bit older that are looking to get pregnant can have trouble getting pregnant. Weight gain is a big one, but again, that's where the misdiagnosis comes in, right? You go to your doctor and say, hey, I'm gaining weight. They're like, hey, get on a treadmill, eat less. They're not looking for other things that can cause it. A lot of people have pelvic pain, and if you're having really strange periods that are really heavy in menstruation, that's also another symptom or sign that you need to go get checked out.
Okay, so I know that imbalanced hormones can cause PCOS. What are some other health maybe conditions that we should be looking out for?
Yeah, so I talked about the weight gain, right? So about 50% of people that have PCOS will actually develop diabetes. So early onset diabetes, if you don't have a family history and you haven't gained weight, should be something to think about. Hey doc, what's going on? Sometimes we might do an ultrasound or a CT scan and pick up that your liver has a lot more fat on it than it should. That's a little bit strange. And then mood disorders. I mean, we talk about be mindful all the time, and so that's really in the topic and in the public lens. But again, sometimes that just may be your hormones swinging out of control.
And you know, as we get older, sometimes our hormones are all over the place. So, oh man, I'm just trying to wrap my head around all this.
Absolutely.
What are some of the other symptoms that doctors typically look for?
So again, I think talking about excessive hormones, we can do tests. We can test for testosterone and different androgens, ultrasounds, right? So it's called Polycystic Ovarian Syndrome. A lot of people actually have multiple cysts on their ovaries, and we can see that when we do an ultrasound. That's a huge sign of it. Insulin levels, that's where it comes into diabetes, having an early onset diabetes or diabetes that can't get controlled with insulin or other medications, and cardiovascular disease, right? If you're 25, 30, add a little bit of weight and you have hypertension, that should also be a trigger for your clinician to at least screen for it. That may not be the cause, but it should be looked at.
Okay, so let's talk about some of the treatment options.
So I think one of the biggest things that people say, well, you've gained weight, lose weight. It's not always that healthy. It's not always that easy, right? But that's one of the things. There's a bunch of other things that can go. I mean, putting somebody on constant birth control can actually even the hormones out, and that can help them not have the symptoms. A lot of times they'll use metformin. That can be good and bad, right? Metformin is a medication that we use for diabetes anyway. A lot of people have, interestingly enough, what's called paradoxical weight gain. They can blow up on metformin, and so they stop taking it. They don't want to take it, right? Acne medication, see a dermatologist. But I think the real important thing is if you have some weird signs going on and you're a female above the age of 16, talk to your physician and have a conversation about it.
Okay, so talk to us about infertility management in women with PCOS.
Yeah, so I'll say this up front. I'm not an infertility specialist, and so if this does happen, please go and see an OB-GYN. Right, I think that's the critical thing, because there's medications that can be taken to improve fertility issues. IVF is also an option that can be used, but again, go see your OB-GYN if you're diagnosed with PCOS and you're trying to have kids. I think that's the real takeaway.
Okay, where can we find helpful resources?
Well, luckily, we have a lot of OB-GYNs in our community, right? Women's Health, El Paso OB-GYN, Her Health, El Paso. You can see all those on the screen. talking to your primary care clinician is a first huge step, because you want to know, hey, something's wrong with me. I don't think this is right. Let's get you screened and then get you to the appropriate specialist eventually.
That's right. It's good to have that relationship with
Absolutely.
your doctor.
Absolutely.
Dr. Lozzi, thanks so much for joining us.
Thank you.